Hello, my darling, and welcome. Please do come on through and just take a seat. Take a seat and make yourself nice and comfortable. Now, please do try and relax. I promise you that today, for your checkup, everything is going to be absolutely fine. I promise you are in good hands and I'm going to take good care of you. Okay, now before we begin with your checkup, I just have a few questions for you, alright? All of them are very simple. Okay, so can I start with your full name, please? And your date of birth. Good, okay, and your current address. Okay. And what is your occupation currently? Okay. Wonderful. Now, have you noticed any changes in your general health? Okay. And has that been concerning you at all, or is it just a general observation? Okay, good. How is your medication going? Are you experiencing any side effects? Anything at all that you'd like to discuss with me there? Okay, fantastic. Have you had any minor injuries or surgery recently that we wouldn't know about? And finally, are there any concerns that you would like to raise with me today before we get started with the general checkup? Wonderful. Okay, my darling, now that all of those questions are complete, I'm going to get started, okay? And I'm just going to start off by feeling the glands in your neck. Just to make sure that everything is feeling as it should. And please do let me know if at all it is painful or uncomfortable. Okay. Okay, good. I'm just going to have a look at the skin as well on the face. Is it okay for me to be up close like this? Okay, good. Have you been experiencing any sensitive skin at all? Any rashes, dryness? Okay, good. Now I can see that you've got a little cut here. When did you do that? Oh dear, okay. Well, not to worry, it's nothing serious, but I will be able to clean that up and just patch it up for you in a little while. Okay, we'll do the rest of the examination first, and then towards the end I will tend to that for you. Okay. But other than that, your skin is looking wonderful, nice and healthy. Okay, and now just have a look at the scalp. Okay, and are you experiencing any irritation in this area at all? Good. Okay, let me just take note of my findings there. I'm going to ask you a few more questions about that cut. Okay. So when was it? Did you say again? Sorry. Okay, and how did you do that? Oh dear, easily done. Like I said, not to worry, I'll tend to that in a little bit. Okay, let's go ahead and take a heart rate measuring and then move down to your chest as well. So just going to put this on your chest. I'm sorry, it might be a little bit cold. Okay, good. I'm just going to listen for a little while. Just breathe normally for me. Okay. Now moving down to the chest, okay. I'd like you to take a big, deep breath in and out. Good. One more time, breathing in and out. Okay, amazing. Everything sounds fine there, which is great. Have a nice, steady, regular heart rate, and the chest sounds nice and clear. Okay, so I'm going to take your blood pressure now, okay? This is very simple, but I'm going to be attaching this to your arm, inflating it with a little pump, okay, and then recording your blood pressure. So let's do it on your left arm, okay? So just hold that up for me. Thank you. Good, okay. So you're going to feel a little bit of pressure now where I'm going to be inflating the armband. If it does get too painful, just let me know, but it shouldn't. Good. Okay. Okay, so we're now going to move on to the ENT part of the examination, which is the eyes, the nose and the throat. Okay, so we're going to start off with your eyes, and I'm going to just shine a light like this, okay, and just have a close look at the health of those eyes. Okay, and as usual, please let me know if anything does cause any discomfort. Okay, and if you could blink for me. Good. Again, blink, blink, blink. Blink, blink, blink. Again, blink, blink, blink. Okay. Now I'm going to look into the left eye specifically, and if you could just follow my instructions, okay? So looking straight ahead at me to begin with, and then look up really well. Now moving over to the right eye, so same again, looking straight ahead at me, and then looking up. That's it. And look down. Over to your left. And to your right. And then straight ahead at me again. Good. Fantastic, thank you so much. Now I'm going to ask you to follow the light, okay? So I'm going to be moving the light in and around your field of vision. And I'd just like you to keep your eyes on the light at all times. Okay. That's it. Follow the light. Good. That's it. Follow the light. Good. Good. Okay, wonderful. Now I'd like you to keep your eye on the pen as it comes towards you and further away from you. Okay, so just follow the movement. Good. Good. Okay. Putting that down. Now I'm going to work on your peripheral vision. Okay, so I'd like you to keep your eyes on me. So maybe choose a spot, whether it's my nose, my lips, my eyes. Just keep your eyes in exactly the same place. I'm going to be twitching one side, okay, so left or right, and I just need you to tell me which one it is, okay? Good. 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 Perfect. Okay. Well done, my darling. Okay, now let's move on to the final part of the eye examination, and we're going to do a quick sight test. Okay, so I'm going to be pointing to letters from each line, and I'd just like you to tell me what it is you can read, if you can. Okay, so let's start off nice and easy. If you can read me the top letter. How about this letter here? Yeah. Let's make it a little bit more challenging. Move down to the fourth line here. If you could read this one. This one. Good. This one. And this one. Great. Now let's read this entire line. So if you could read from this letter here to this letter here. Good. How about this line here? If you read this one. Yeah. This one. This one. This one. And this one. Good. Can you read anything from the bottom line? Great. Okay. So your sight is looking absolutely perfect, as is the rest of your eye health. I'm sure you'll be glad to know. So, I'm now going to just have a look at the nose, okay? It's not going to be invasive at all, I'm literally just going to look. Okay, do you ever get nasal decongestion? Good. Any hay fever or allergies at all? Okay. Now let's have a look in your mouth. So if you just open up nice and wide for me. Good. And say ah. Fantastic. Perfect. So everything from the ENT examination is absolutely fine. Right. Let me just take a note there. Everything absolutely fine. Okay, I'm now just going to quickly check the reflexes in your knee. Okay, so I'm just going to go down. I like to relax your legs. I'm just going to gently tap just below the kneecap. I promise it doesn't hurt. I'll be nice and gentle. Okay, 3, 2, 1. Okay, once more. Good. Alright, I'm going to have a look inside your ears just to make sure that they're nice and clean and nothing is obstructing your hearing. Alright, so let's start off over in your left ear. Just gently having a look. Do you struggle with your hearing at all, or is everything normal? Okay, well, I can definitely see that this ear at least is a little dirty and will require a quick clean. Alright, let's have a look over here. Alright, I think it's the same over here where we will need to give it a quick clean. Alright, nothing to worry about. It'll be nice and straightforward. Alright. So, just gonna get some cotton swabs. Just give this ear a good clean out. Let me know if anything's uncomfortable at all. really, really well. Nearly done with this here. Okay. Moving on over to your other ear. This one actually isn't quite as bad as the other one, so nearly done here as well. Perfect. Now that your ears are nice and clear, we can go ahead and conduct a quick hearing test. Alright, so at least then if there is a problem with your hearing, we can know that it's not due to the cleanliness and due to perhaps a more serious problem. So I'm going to start off with the tuning fork. Okay, so I'm going to be banging this, letting it ring in each ear, and I'd just like you to tell me when it is you can hear it stop. Okay, so I will be able to feel the vibrations, and as soon as I stop feeling the vibrations, I'll know that the ring has stopped as well. Now, if you are experiencing problems with your hearing, you might say that the sound stops before it actually has. Okay, so let's start off with your left ear. Okay, and the right ear. Good. Do the left ear again. Good. Okay. So that's part one of the hearing test. Now for the next part of the hearing test, I'm going to be whispering some trigger words into each ear, and I'd just like you to repeat them back to me. Okay, very, very straightforward and very simple. So let me just get up my words. So starting off in the left ear. Sleepy, sparkle, snowflake. Okay, I'll repeat those once more. Sleepy, sparkle, snowflake. Can you repeat those back for me? Sleepy, sparkle, snowflake. Good. And moving on to the right ear. Pumpkin, particle, tingles. Okay, I'll repeat it once more. Pumpkin, particle, tingles. If you could repeat that back for me. Pumpkin, particle, and tingles. Good. Okay, let's move over again to the left ear. Coconut, chocolate, cupcake. Okay, and I'll repeat it once more. Coconut, chocolate, cupcake. coconut, chocolate, cupcake. Over to the left here again. Skeptical, cookie, relaxation. Repeat it once more. Skeptical, cookie, relaxation. Skeptical, cookie, relaxation. Good. Back over to the left here for a final time. Cookbook, clockwork, perfect. Repeating that once more. Cookbook, clockwork, perfect. Yes, well done. Cookbook, clockwork, and perfect. And finally, over in your right ear. Pickle, tickle, stipple. Repeating it once more. Pickle, tickle, stipple. If you could repeat those back for me now. Good. Well done. So hearing is absolutely fine. Now, to conclude the examination, like I said earlier, I would just like to tend to that cut on your forehead. Alright, and then everything aside from that is completely fine and you're okay to go. Okay, so I'm going to start off by just spraying the area, okay, with some antiseptic. Alright, and then I'm just going to use a cotton bud to clean up any of the blood. Good. Okay. Now to go in with an antiseptic wipe again, just for extra care and precaution. These actually contain aloe vera as well, which helps to soothe the area. Sorry, darling, does that sting a little bit? Oh dear, okay. Nearly done. Perfect. Now just to apply a bandage. So I'd recommend keeping this on for the next 12 hours. And when you need to wash your face or have a shower, replace the plaster. And then after about 24 hours, just leave the scab to heal. Okay, just gently popping that on. There. How's that feeling? Yeah, it's definitely going to be kept clean a lot easier now. if the cut does get any worse, please do just let me know and I can have another look. Okay, well, there we go, my darling. That is the end of your medical examination and checkup for today. Thank you so much for coming in. It's been wonderful to see you, and I look forward to seeing you next time. Good night and